I'm super excited to be here at Physical Evidence Chiropractic. I'm visiting Dr. David Lipman, who happens to be a chiropractor, and we're going to learn about how this alternative method has helped people heal without surgeries and without dangerous pharmaceuticals. I've chosen Dr. David Lipman because he is the leader in this industry, right from his treatment plans, his treatment philosophy, and this amazing family-style practice. This is going to change the way you see chiropractic.
Chiropractic is the philosophy, art, and science of the idea that manipulating the joints, especially the spinal joints, will help to get the body to restore itself through proper nerve flow and blood flow. My name is Dr. David Lipman. I'm a chiropractic physician here at Physical Evidence Chiropractic in Boca Raton, Florida. My philosophy as a chiropractor has really evolved over time, where I see it as a much more interactive process with the patient. I consider what I do to be a re-engineering of the patients mechanically. So what I've learned over time is that regardless of where you feel pain, it's only ending up there. It's not coming from there. So understanding what that looks like from a treatment standpoint, and to give the patient what they need to do to reinforce the changes that we make mechanically, is key to really resolving issues. So although it's usually where people are going to look to the area of pain and they think that's the problem, it's not where the problem is starting, and that's the key difference that I find in how I practice now versus how I used to practice, and the results are so much better. In fact, it extends way beyond the spine to, extremities like the knees, the feet, the ankles, the hips, shoulders, elbows, wrists, everything, because the way I say it to my patients, the body functions together and it dysfunctions together. And knowing that and understanding that is key to get a very successful treatment plan. So once I've done that full assessment, understanding where the pain is and then looking at where it's coming from, I have a very integrated process of how I start, usually at the bottom from the feet, and work my way up to sort of re-engineer and realign in a very dynamic way to the patient, their musculoskeletal mechanics and structure as it pertains to weight bearing and movement. And my process is very interactive. I have a specialized table that allows me to isolate movements of the body, and I have other tools that I use, vibrational tools, percussive tools, that help to reestablish the proper nerve functioning between the brain and the muscle and the joints. Because anytime there's injury, there's actually a reduction of sensory input to the brain, and the brain actually kind of flips from a functioning mode musculoskeletally to a protective mode. So the functioning of that person is no longer mechanically sound, and that's the correction we seek out to make. I feel a great passion for chiropractic. In fact, I don't feel like it's work for me. I feel like I've really been purposed for this. The reason is that I've had such numerous injuries from a very young age, and it was those injuries that prompted me to seek out, how do I deal with those? And I've been given insight and discernment that I didn't learn in school and I didn't learn in any one place. But over time, as I've learned that, it made me realize that this is really what my life's purpose is. And I'm very passionate about it because the things that I do here in the office are so simple for me to deliver, yet it has a profound effect on people. And when you could just put your hands on people and do a little bit of moving them around, so to speak, and take care of their pain and change their lives, because so many people suffer chronic pain needlessly because they just haven't found the right combination to make it work. And when I can deliver that to somebody, it's very personally rewarding. There's no amount of money that would really compensate me for the kind of feeling I have when I could restore somebody's life. And I don't really believe that it's me. I think I'm very fortunate that I've been given the ability to find out how to do it for myself, and then I can deliver it to the patients and again, really change quality of life for many people.
I'm Lindsay Martinez, on a mission to take you from simply surviving to finally thriving. We'll see you next time.